Hey there, I'm Dr. Bill Tortoriello, your local DNS Pediatric practitioner, and I'm ready to share some great handling tips for you and your 5 to 7 month old babies. So let's get started. Just to be clear, these tips pertain to babies aged about 5 to 7 months old. Now, they're not a formal prescription for treatment, however, they can be really helpful to guide normal baby development. So, with our babies lying on their backs and us standing at their feet facing towards their heads, we can grab a hold of either leg and lift and flex their legs and hips up towards their chest, kind of tipping their pelvis up towards their head, so that way we're getting a little bit of support into the shoulders as well as actually lifting that pelvis up and off the ground. These are all things that typically normally occur during this phase, and we can help to facilitate with this positioning. Additionally, from this position, we can touch the soles of their feet together to start to give them some sensation and stimulation at the bottom of their feet. We can bring their hands to their feet, and finally, we can even bring their feet to their mouths, typically something that normally occurs during this phase and can be helped by showing them what to do. In an effort to train rolling from this supine position, we can grab a hold of our children's thighs, flex one hip up and forward and rotate it over to the side as if they're stepping. The other leg will actually straighten and extend at the same time. This is what typically happens during rolling or turning over from our backs to our bellies, and helpful to show our children what is possible during this time. Of course, rolling is primarily initiated when the child turns its head to the side to look for the toy or look at the parents, as well as reach across the midline with their hand in an effort to get that toy. So, we can use the child's favorite toy as a way to entice them to roll to one side or the other. All practical tips that can be helpful to guide normal baby development. From their bellies, we can help to train normal development by placing our children into the all-fours position, which is either on their hands and knees or even their elbows and their knees. From here, we can train the position a bit more by rocking them back and forth from their pelvis and hips, making sure to keep their spine straight and also making sure that their shoulder blades don't wing up and off of their backs. Alright, hopefully everyone learned something useful today. If you ever have any particular questions about the DNS approach to pediatrics, please check out the links below. I'm Dr. Bill Tortoriello. If you haven't already, subscribe to the channel and hit the like button. Otherwise, I'll see you next time.